I'm sure you must have seen the pyramid of diabetes or any diet. There's nothing called diabetes diet. At high fibrous fruits, cereals, vegetables, small amount of protein and a little amount of fat intake. And that's what's called a balanced food. You know, in your class 3 standard book, even in the 1960s had this pyramid, and I'm sure in the next 1,000 billion years it will not change, because we have tried in science trying to alter the combination of protein and different diet combination, but on a long term, this is the diet that works for us. So there's a myth that only the international food chains creates the junk food in our country, but I think we have indigenously built junk food. It means very processed, sweet, saturated fat and trans fat with processed carbohydrate and processed sugar added in it, fried food that we have in our society inbuilt in. So we don't have to go to international food agencies to really look for the junk food. We have a lot at home, a lot going around in the market. You know, variable demand, your age, your sex, your climate, your health, the state of nutrition will require your calorie need. But the basic calorie need is defined in the, and it should contains the vitamins, minerals, water, protein, carbohydrates, and fats. And the carbohydrates, the most important part of the carbohydrate is it has got 3 forms: sugar, starch, and fibers or cellulose. So I think there's a lot of confusion exists with the carbohydrate. So the definition of calorie is 1 calorie is measurement of in a unit that what we can measure, that what we can extract from the food. To tell you that an average 70 kilograms walk for 30 minutes brisk walking would consume 150 calories. Now, equivalent to that, the 330 ml Coke, you may have 150 calories, one samosa will have 250 calories, 100 gram bhujia would have 550 calories, 100 gram banana around 75 to 80 calories, and 100 gram biscuits will have 450 calories. It's a very rough estimation to define that how much average food can give you calories. For example, if you have 5 tablespoons of sugar, you may have to walk around 100 for 10 minutes to consume that calories. The basic unit of calorie is defined in per gram. The protein is 4 calories, the carbohydrate is 4 calories, and fat, any fat you take, be it olive oil, be it ghee, be it any butter of 1 gram would have 9 calories. So that distinguishes that, for example, if you have a sugar of 1 gram, it's just give you 4 calories, and a 1 gram oil, if you eat, that will be 9 calories. Any form of oil. I'm not saying that you should eat ghee, I'm not saying olive oil. What I'm just trying to convert that sometimes we really get confused that the olive oil has got less calories. That's not correct. It's a better oil from the LDL cholesterol point of view, but we have to understand this as well. And carbohydrate, I'm going to just go into the basic of carbohydrate, because that's what the metabolism goes wrong in diabetes, that the glucose which goes into the blood vessels needs to be transported into the cell. Gradual release of glucose into the blood vessels, if we eat complex carbohydrate, then there is sufficient insulin or medications would work easily. If you give body yourself a rush of glucose by eating glucose or sugar, the glucose goes straight to the blood vessels, and the body, even have little insulin or sufficient insulin, may not be able to catch those glucose and put inside the cell. So it is that you have to eat carbohydrate, which is 50 to 55% of the diet. Any food pyramid would tell you that. So it's very important to understand that which carbohydrate that you should take. And it comes to a simplest carbohydrate is glucose. Glucose, it goes straight to the blood. Fructose from the fruit, and the galactose in the milk form, the sucrose in the table sugar form, and we have complex carbohydrate in form of, cereals, and the fibers coming from the plant extract, which are not able to digest. The more you go to the starch and complex carbohydrate, the slower the glucose absorption, and it's easier for body to adjust that glucose level easily and the medications to work. And even if you don't have diabetes, it's better to have starch and complex fibers compound rather than a simple carbohydrate. And if you look at the fruits, look at the cherries, they have low glycemic index food. In fact, the mangoes are in 50s and 60s, banana is 58. One thing about the watermelon has got one of the highest glycemic index after, and the dates. But the watermelon quantity of the water is so high and the amount you take is usually small. So watermelon has got one of the highest glycemic index, but we still recommend to take it. Mainly because the amount of watermelon usually, because of the water content is not that high. So that's why it's very important to continue all fruits and vegetables, including all fruits, including apple, have just glycemic index of 34, strawberries 40s, kiwi fruits, which is equivalent to chikus around 50s, papaya is 60, banana is 58. There can be variations between how much sweet it is, but that's what the standard mechanism. And I don't expect you to know all this in detail, but it's just to clarify the concept that the majority of the fruits are good for you and you must eat fruits, a couple of fruits a day. And the vegetables have, because we're not able to digest these vegetables, so some of them hardly gives them any calories, be it cauliflower, be it cabbage and broccolis, very low glycemic index, be it raw carrots, boiled carrots. The more you boil it, easier for us to digest. That's why there's a difference between raw carrot is 16 versus boiled carrots is 41. But what I will strongly recommend, this slide is telling you that more vegetables, more fruits. Same thing, medium and high glycemic index. Those are little under the earth, may have a little more high glycemic index, but still around 60. So you don't have to really get scared about eating, any vegetables. The fruits is a must in your diet. The question is how much fruits. If you look at 5 fruits fiber a day that across the world is recommended. So if you have your wrist size or one tennis ball size, a cricket ball size apple is got 1 fruit, which could be a mango, which could be a banana, and you can have canned fruits as well, or dry fruits as well, half a cup, and you can have 1 glass of a fresh juice. And in vegetables, you can have at least 1 cup equivalent of vegetables, half a cup of vegetables, fresh or frozen vegetables, and half a cup of tomato soup or a tomato juice extracted from the fresh tomatoes rather than in canned form. So what we recommend that you must have 4 to 5 servings of fruits and vegetables. That's the most essential part of it. When we talk about diabetes, we talk about cholesterol, blood pressure, cancer, not just the sugar. So it's very important that whatever diet we're recommending, it's just not sugar, because we have high cholesterol, we have risk of heart disease, the blood pressure is quite commonly associated with diabetes, it's a salt reduction, and more fruits give you a high potassium diet, and that also brings the blood pressure down. So it's just not the sugar diet, that's what we're concentrating on. We're concentrating on the whole balanced diet. A couple of things on protein. Protein is the muscle building block of the body. It's very important to take protein either from plant or animal source, and you must pair 2 foods together, like what we eat, rice and dal, or rice and beans, or rice and rajma, especially those who are vegetarians. Non-vegetarians have more options. And in regards to fat, the diet is very simple. What I call is that any food which comes from the plant, oil, is good for you. So any food, any oil which comes from the plant extract, be it olive oil, a canola oil, a sunflower or a safflower or sesame oil, they're good for you. Anything also, they have the monosaturated fatty acids. They also have polyunsaturated fatty acids, which is also contained in certain fish, especially the trout and salmon. But in regards to polyunsaturated fatty acids, they also have omega-3, and they're good fats that bring the LDL cholesterol down. Usually from the plant oil, they have higher amount of monosaturated and polyunsaturated fatty. There's only one exception of coconut oils and the palm oils, which is the plant extract oil, which has got more trans fat, but majority of the olive oil, sunflower, canola, peanuts oil, safflower, sesame oil. In other words, those those who don't freeze the room temperature, they're good for us. And any oil which freezes in the room temperature is not good for us. It means they have higher saturated fat and trans fat. So those oils who are normal consistency, liquid consistency, are better for us, which mainly contains monounsaturated fat and polyunsaturated fat. Mind it, the oil should not be hydrogenated. The typical example of dalda, which is hydrogenated oil, should be avoided. And the saturated fat mainly contains in beef, lamb, pork, the poultry with the skin on, the butter, paneer, and the cheese. They have bad saturated fat. The trans fat is usually, it's in the coconut oils and the palm oils. But any food you cook them become trans fat because they also freeze. And mostly all pastries and the cookies and the biscuits, the frozen pizzas, and all these have got high amount of trans fat. So it's very important to understand that oil you should have from the plant extract, except the palm oils or the coconut oils, and majority of the oil which is in liquid form is good for us. Anything which is in the solid form of oil is not good for us because that's bad for the cholesterol. So in other words, the plant extract which comes from the sunflower, the sesame oil, the olive oil is good for us. We call it unsaturated fat. The saturated fat are more frozen. It should be avoided. I must tell you, both gives you the 9 calories. It's about the good fat and the bad fat. When we talk about the diet, the vitamins comes naturally to you. If you follow the fruits and vegetables diet, it will give you the balanced vitamin B complex and vitamin C, which is there in fruits and vegetables, and green leafy vegetables of a different color. You also have a fat soluble vitamin, which I'm sure you all know about it, A, D, E, and K. But most of us require vitamin D supplement from outside because we don't go to sun, and the milk has not sufficient quantity of vitamin D. Most Indians will have vitamin D deficiency. So most of us would require vitamin D supplements. Otherwise, it comes from oil and green leafy vegetables. Few words about the sugar-free options. We don't recommend eating any sugar-free options. Better to have plain water. But when it comes to a 2 teaspoons of sugar, it's around 30 calories. Now, if you drink 5 cups of tea, it gives you 150 calories. For that, you have to walk 30 minutes. So what we say that if you have sugar-free, it just reduces calories. But otherwise, most sugar-free has been found to be safe, which is available in the market. And we'll have another video for sugar-free. But broadly speaking, we do not encourage it. But if you are taking sugar, you can replace with the sugar-free a couple of times in a day. You should have plenty of water, but I must warn you that drinking excess large amount of water, more than 3 liters or 4 liters, under liters, you're dehydrated, you've gone in sunny places. We do not recommend large amount of water. An appropriate amount of water is required. You don't have to drink excess 6, 7 glasses first in the morning. Unless your sugar levels are very high, you've been dehydrated because you're urinating more water. So it's very important to compensate that. Salt should be avoided. We do not recommend taking any extra papad or achar because that gives you extra salt. The salt content should be minimal. There's no problem with the masala, mind it, but when we use masala, we use a lot of salt and oil. Otherwise, be it any masala which is good for you. Alcohol content should be minimal, something around 12 to 15 units in a week. So one small whiskey is 1 unit, 1 glass of wine is around 1 unit, and a 300 beer on an average is around 1 unit. So you should avoid around 10 to 15 units a day. So in other words, you can have 2 to 3 small drinks 2 to 3 days a week. But again, we do not recommend alcohol. Those who drink alcohol, to tell them to limit them. That's what we recommend them. So overall, the diet should be the complex carbohydrates which come from the rotis and the grains, the vegetables, the fruits, and the small amount of oily materials. That's what the diet recommendation is all about.